All right, I am on Facebook Live again. This is Ask the Doc. I apologize if this is like the second or third time you've seen me on Facebook Live right now because my microphone that I just bought off of Amazon, it's right here. I can plug it into my phone. I'm supposed to. It's got the jack here, and apparently, yeah, it's not really recording sound when I do that, and it goes into like some sort of, I don't know. You can't hear anything when I plug it in. So that's kind of the exact opposite use of a microphone. So I'm gonna have to figure that out. But if anyone watching uses Miracle Sound lavalier microphone, it got good reviews on Amazon, which is disappointing, but it was only $10. So a lot of times you get what you pay for. So sorry, Jess was asking why I'm talking about this. Simply to explain that I tried to get a good product. So today's topic is on plantar fasciitis. No, I'm not restarting it. So I can always trim. Anyway, so plantar fasciitis, what to do about it? How do you know you have it? That is a big question that I get quite frequently because it is actually it's one of the most diagnosed foot injuries in the adult population. 15% of people end up with plantar fasciitis at some point, and it can be debilitating. It can be very irritating. A lot of the running population end up being affected by this. It's actually, according to a study in 2008, so that was about 10 years ago, but 8% of all diagnoses that it was plantar fasciitis was among those. So that's a high percentage of the population that it is affecting. And again, it affects a lot of runners. It can be very common in runners, and it can hinder training. It can affect performance. And that is what I love helping people do, is to overcome that, so that way they can reach their goals and overcome those nagging injuries like that, or debilitating injuries, and get them performing well. So, how do you know if you have plantar fasciitis? And what is plantar fascia? Plantar fascia is on the bottom of your foot. It is part of the intrinsics of the foot that help with structure and stability of the foot. And when that plantar fascia becomes inflamed and irritated, that is what plantar fasciitis is. It is an inflammation of that and an irritation. And a hallmark of it is heel pain, which is right where that plantar fascia inserts, is at that base of the heel. And so that, just because you have heel pain, though, doesn't necessarily mean that you have plantar fasciitis, but it is a hallmark sign of it. And, another big sign of plantar fasciitis is that heel pain, that especially people will most likely notice it if they've been inactive for a long period of time. So if you're sitting, or first thing in the morning, you go and you get up and those first couple steps are excruciating, and then you're able to walk it out a little bit and it gets better. That's usually pretty common in people with plantar fasciitis. Or, if you have been on your feet all day long and you're on your feet for a prolonged period of time, a lot of times it will then get worse with that too and be pretty debilitating. So if you are, for example, in construction or waiting tables at a restaurant, something where you're on your feet all day, you are a little bit more at risk than others. Some things that are not common in plantar fasciitis to take into consideration is numbness and tingling. So that's usually signs of something else. That's usually signs of a nerve issue that is not related to is not a true plantar fasciitis. And so if you're getting numbness and tingling into your foot, that is not a good sign, and you do need to consult with a healthcare professional to, figure out what's going on with that and what it is that's causing it. It can be a number of things. It could be a nerve entrapment. It can be a lot of things. It could be coming from the low back. So you do need someone to rule in and rule out those different diagnoses that are possible with it. So, you're probably wondering, Eric, that's great. I know I have plantar fasciitis. I looked it up on WebMD, so I don't need your help in diagnosing this. I have all these symptoms. What do I do about it? And the first and foremost, the best thing that you can do to start, step number one should be to consult with a healthcare professional, such as a physical therapist. You could even go to a podiatrist or physician if you want. As a physical therapist, I know that we are trained to treat a lot of these injuries, and treat plantar fasciitis especially. I see it all the time. And it's important that you go to someone that is trained in it, because everyone's bodies are a little bit different, and you need someone to come up with a plan that is specific for you. So just because, Jan down the street, she had plantar fasciitis and she put in a heel insert or something like that and it helped her, it doesn't mean that it's going to fix your problem. And, you want to make sure that you are spending your money, effectively and efficiently and not wasting it. So there's nothing more frustrating for me as a consumer, or, if I'm in pain, than going and doing something that is, I've spent my money and now it's not working, and now it's even further along and I've been dealing with it and I can't do the things that I want to do. So that is the number one piece of advice. Some short-term solutions that a lot of people will say, the old, freeze a water bottle and roll your foot on that. That can help with pain modulation. It's definitely not going to cure your plantar fasciitis, but it can help with the pain modulation. And you're not going to harm anything doing that. So that can be fairly effective if after a long day, you take a frozen water bottle, roll your foot on that. That can help with that. So that way you can better tolerate doing a home exercise program that is custom for you. So, definitely doing some, a lot of times too, people with plantar fasciitis, they've got a lot of restricted flexibility and ankle mobility. So paying attention to that. A good quick test to see if you have good ankle mobility is have your foot right in front of a wall, so your toes are touching, okay? Keeping your foot flat on the ground and your heel flat down. Can you touch your knee to the wall without lifting your foot up? If your knee can't go past your toes without your heel coming up or your foot lifting, then you definitely have some ankle mobility issues that need to be addressed, and you need to work on those. And then, like I had mentioned before, a strengthening program. So you want to make sure that you have a program that is addressing all areas of the lower kinetic chain. And so what do I mean by the lower kinetic chain? I'm talking about not only the foot and ankle, but the knee, the hip, the low back, and core stability. All of those can play a role, because if you have an area that maybe is being affected, that could actually be what's causing your plantar fasciitis. And the key could be treating that and not just only looking at the foot. A lot of, people with plantar fasciitis issues also have a hip issue. They might have a hip issue going on that is affecting their foot, and it's affecting the way their foot meets the ground. It's affecting the way they walk, and therefore causing that irritation there at the bottom of their foot, at their heel, and at their plantar fascia. Proper footwear is extremely important. If your shoes are older than 6 months to a year, you need new shoes, and you need shoes that are comfortable and for you. Skimping out and buying that $20 pair of shoes, or buying the pair of shoes because they look cool. I know Jessica Pollock, she's watching, she's guilty of this. You need shoes that feel good and are comfortable to wear. not just the Nikes or or the Adidas that look good and that your best friend has, and you gotta top them and get some ones that look cooler. So make sure that they feel good on your foot and they're comfortable to walk in or run in. If you're running, they need to be comfortable to run in, and they need to provide the proper amount of support. So a lot of people with plantar fascia issues, have a very supinated foot, a very high arch, that can put you at risk. Being flat-footed can also, put you at risk. Those are definitely things to take into consideration. And then you're probably asking, well, what about an orthotic? Do I need to go spend $300 some on a custom orthotic? Do not go out right away and spend that amount of money on a custom orthotic, unless you've consulted, with someone. But an over-the-counter orthotic, there are a lot of different ones. There's Superfeet, there's ProFeet, there's Curex out there. There's a ton of different ones, but the biggest thing is finding one that works for you and finding one that is comfortable, again, to wear, because the biggest key, again, is comfort. You should not have to force yourself to wear it. And